Many parents are anxious about children going back to school as COVID-19 infections soar in South Africa. The country has recorded its highest ever death toll in a single 24-hour period. And reports out of the United States have raised some concern about the vulnerability of children. It's being reported that pediatric cases now account for 11% of all cases in the US, up from just 2% earlier. And then there are the challenges of wearing a mask. Mask wearing is compulsory in public, but it has been clarified earlier that this excludes children at least under the age of 6. To discuss, we're joined now by Professor Shaheen Mehtar, who is a retired infection prevention and control specialist at the University of Stellenbosch. Thank you for being with us, Professor. So firstly, this under 6 no mask wearing decision, is that wise? Is it a good one?
Thank you very much for the invitation, and thank you for having me. Well, it's based on science, it's based on evidence, and it's very clear that even though everybody is susceptible, including children under the age of 5 are less likely to be are less susceptible. So even though they are carrying the virus, they might transmit it, they themselves have very, very poor infection rates. In fact, they have very little infection.
Professor,
okay.
Sorry, we lost you shortly there. Continue. You say that amongst young people, the infection rate generally low, I think you said?
Are very low. In the data which is available from us in South Africa, from the National Institute of Communicable Diseases, who do a lot of data collection and have been doing so from the very beginning, the European community, the CDC for the Europe and other parts of the world have shown that children under the age of 5 do not actually, while they do acquire the disease, they do not actually get the symptoms of the disease, and they're less likely to be admitted to hospital. So in our part of the world, it's about 4%, I think.
If the children are okay, what about the people coming near those young children? The idea is that they could be carriers still. Should you be careful if you're with a young child not wearing a mask?
Yes, I think they have been known. There is evidence to show that the children can transmit, but they don't have such a high viral load. So the reason that the WHO and the CDC and South Africa have said that the under 5s don't need, because they do not need to wear a mask, is because the chances are that they probably will only be in contact with their own families and within their own family bubble, as it were.
Yeah.
So that is probably one of the reasons, but also the fact that there's very little evidence to say that they will get infected or that they will get serious disease.
It's also pretty impossible to ask a 1-year-old, 2-year-old, 4-year-old, 5-year-old to wear a mask. But isn't it pretty hard for the 7-year-olds, the 8-year-olds going to school wearing this sort of oppressive mask every day that they're not used to?
No, you're absolutely right. For children to manage a mask below the age of 5 is really difficult. However, over the age of 5, 6 or 7, as you mentioned, when they go to school, what we have advised the Department of Basic Education is that they do wear a mask when they are inside, but every 2 hours or so they should actually get a break, and they should go outside in the playground in a marked area where they can take their masks off and breathe. And then put them back on again when they come back inside. So, and the reason is that even though they have a lower count of viral load, they can also transmit. And as they get older, particularly going up towards 12 or 18 years of age, they have the same load as an adult would. So they carry a much larger viral load.
Professor, can we go back to what you were saying, that young people often don't get very sick or even show the symptoms, but there are reports coming out of the United States that more children are getting infected. Firstly, anecdotally, here some doctors are saying that they're seeing more children and more children getting very sick. Do we really know how vulnerable children are right now, especially in light of the new variant that's been found?
Yes, I think that is a very fair question. I think the reason the United States has got such a high level is possibly because they just have the highest level of cases in the world. And so as a proportion of that, and also because of the way they've managed to sort of contain this virus, which in fact is now improving dramatically with the vaccine, it is quite possible that their children would be infected more than most of the other countries have reported, particularly from Asia and from Europe. So, I think that's quite clear. I think you're right. I think there has been, because there's a surge again, the second wave as it's called, there probably will be more children admitted to hospital. But the National Institute of Communicable Diseases looks at the age admissions as part of the entire testing program and the number of positives that have come in. Plus, they look at the number of people admitted to hospital and also the deaths. And from the data from as recent as November, end of November, there was less than 4% of those under the age of 5. So, yes, there's a burden, but in fact, it was better previously and now it's gone up a bit. And maybe that's why it becomes more visible.
Okay, but generally still low risk. Professor, before we let you go, you're concerned about infection prevention. Everybody's sort of hoping for the vaccines, but it looks like it's going to be a very long time until we achieve that herd immunity. I'm interested if we're starting to get a really clear picture of to what extent exactly statistically it helps people to wear masks, the wearer and the people they come into contact with.
I think it's really important to understand that the vaccine is not the panacea of all evil. Even after we have been vaccinated, and all of us have been vaccinated, we know that the virus can mutate, and as we're quite aware at the moment, we've got a variant of the virus which is quite transmissible, and therefore it is not only advisable, but I think it's absolutely essential that all of us remember that we have to wear a mask, we must socially distance, we must carry out hand hygiene, and where possible keep our environment clean. What the vaccine hopefully will do is to reduce the symptoms in a person, and I really don't feel qualified to talk any more about the vaccine. I think there are other people far better qualified than myself to talk about it. But basically that is a situation where the infection control aspects must remain in place. And I think that is a very important message to take home.
Very quickly, to what extent, statistically, then, does wearing a mask help you or help the person you're close to?
Well, if you are the source and you're wearing a cloth mask, which is actually the one that protects the other person, you're looking at between 65 to 70% reduction in the amount of viral load transmitted. If you are inhaling it from somebody else and they are also wearing a cloth mask, then they can only transmit less than 25 to 30% to you. So if you're standing far away, the chances are pretty small that you will become infected.
Yeah,
I think it's quite important to understand that in the community it's source control, and when you go into healthcare facilities, we're looking at the healthcare workers wearing surgical masks or respirators to prevent inhaling large quantities of virus or indeed any viral particles at all. And therefore, when you wear a mask and you have your nose sticking out, it really rather defeats the purpose. So the idea is to cover your nose and mouth.
Yeah, thanks for repeating that, because you still see so many people who wear it just below the nose line. An incredible difference, mask wearing versus not. Thank you very much, Professor Shaheen Mehtar, who's an infection prevention and control specialist linked to the University of Stellenbosch.